So glaucoma is a disease of the eye that affects the optic nerve. It's where the optic nerve dies slowly over time, and it's related to increased pressure in the eyes or increased intraocular pressure. This is the optic nerve in the back of the eye. This is what transmits information from the eye to the brain. When glaucoma occurs, this is a nerve that becomes damaged, and it's damaged slowly over time. The hole in the center of the nerve that you can see the blood vessels coming through will get larger over time. If you have glaucoma, largely you're asymptomatic. So most people who have glaucoma, especially in the early moderate stages, they're completely unaware. Not until the end stages of the disease do you develop any symptoms. The symptoms that somebody may experience with glaucoma in the advanced stages is really blurring of vision or reduction in the side vision, so your peripheral vision may get reduced. If glaucoma is left untreated, in many cases it will lead to blindness. Glaucoma is irreversible, so once disease or damage happens to the optic nerve from glaucoma, we can't reverse the changes. So being able to identify it in its earliest stages is really important, so you prevent someone from losing functional vision. The older you are, the increased risk you have for glaucoma. There are certain demographics as well too. People of African descent, people from Caribbean descent as well too have increased risk of glaucoma. Someone who's had trauma to the eye, for example, may have increased risk. Somebody who's been hit in the eye, for example, they may have damage to the structures inside of the eye. Treatment for glaucoma really hinges on reducing the intraocular pressure. So all the treatments are aimed at the same thing. The method of reducing the intraocular pressure can vary. What's been done traditionally is the use of eye drops. So someone may use an eye drop either once a day, twice a day, sometimes using multiple eye drops throughout the day, but it's all aimed at reducing intraocular pressure. There's also laser treatments for glaucoma, and laser is starting to become more and more as a primary treatment, so initial treatment with laser. And what it does is stimulate the outflow, or it stimulates how quickly the fluid inside the eye drains from the eye. And then there's incisional surgery. Incisional surgery is reserved for patients who are not responding quite well or adequately to either the drops or to laser treatments. Most patients who are treated will have a positive outcome in that their disease will be slowed enough that they wouldn't notice any symptoms throughout their lifetime. So the biggest thing is really make sure you have regular eye care visits so you can identify these signs or identify glaucoma in its earliest stages so it never leads to vision loss.